Hello, I am Kaitlin Rэй, and this video is an inquiry into how efficient movement principles, as understood by the Access Syllabus, affected joint pain and instability in my second pregnancy. I have only recently started studying with instructors who teach according to principles from the Access Syllabus. Therefore, my explanation and demonstration of energy-conservative ways of moving that are essentially safe for the body is still in development. In this video, I may not represent these principles in their purest, most rigorous form. What this video does do is show my understanding and execution of these principles at the time of my second pregnancy. Before I begin, let me tell you about myself. I trained at the National Ballet School of Canada and danced with Ballet Organ Canada, the National Ballet Company of Canada, and Tiroler Landestheater in Austria. As is common for a professional dance artist, I experienced numerous dance injuries. By the age of 30, I had chronic knee pain, and I was diagnosed with osteoarthritis, which is wear and tear of the cartilage. I had surgery on both knees to repair damage. It was around this time that I started to choreograph, teach dance, and pursue my master's degree in expressive arts therapy. I also started to practice contact dance improvisation, a partnered dance form based on martial arts principles. During my first pregnancy, I started a fitness program I thought would help maintain my strength and support the weight of the pregnancy. It involved my regular dance activities as well as mat Pilates, pregnancy aquafit, and pregnancy yoga. In these activities, I adhered to parallel alignment of my legs. This alignment was recommended to me by my physiotherapist during recovery from my knee surgery. The idea was that my over-turned-out ballet stance had hurt my knees. The recovery period after surgery was a chance to retrain myself to walk, climb stairs, and exercise with my legs and feet in what was thought to be a healthier alignment. 5 months into my first pregnancy, I experienced intense pelvic girdle pain due to a condition called symphysis pubis dysfunction. This is a condition where the two halves of the pubic bone, normally held together by ligaments and cartilage, separate. I also developed diastasis recti, a condition in which the connective tissue that normally holds the rectus abdominal muscles together gives way, resulting in separation and muscle weakness. Both conditions are common in pregnancy because of the pressure from the growing baby and the pregnancy hormone relaxin, which loosens joints to help make room for the baby and for delivery. I also experienced a worsening of chronic knee pain due to the extra weight of the pregnancy. Here are my midwife's notes from my first pregnancy. If you look at the area I have circled, you can see that by 6 months of pregnancy, she prescribed Advil or Tylenol to help control pain due to symphysis pubis dysfunction, or, as it says in the files, SPD. I was in so much pain for most of my pregnancy that it was difficult to do simple tasks such as climbing stairs or rolling over in bed. After giving birth to my son, my recovery was slow. It took a year for all these conditions to gradually resolve.
My name is Dr. Michael Summers. I'm the clinic director at Evolve Complete Chiropractic Care. I started treating Kathleen after her first pregnancy. She came in complaining of midline pubic pain and some abdominal discomfort and diastasis recti. A lot of pain with particular movements in the midline of the pelvis and some issues with pubic symphysis.
And how long did these issues last for, or when did she fully recover from them?
It took a while. I'd say it's in the neighborhood of months to a year.
It was at this time that I discovered the Access Syllabus. The Access Syllabus is a collection of universal biodynamic movement principles that are essentially energy conservative and healthy for the body. It is a user's guide to the body that gathers together scientifically sound data on how muscles, fascia, tendons, and bones function. The Access Syllabus can be applied to all forms of movement. For example, it has influenced not only my dancing, but my everyday activities such as walking, climbing stairs, getting up from a chair, and getting out of bed in the morning. Here I am a few weeks prior to my second pregnancy studying the Access Syllabus in a class led by Matt Smith. When I became pregnant for the second time, I was worried about a repeat of debilitating joint pain. There is, in fact, a 70 to 80% chance of repeat of diastasis recti and symphysis pubis dysfunction in subsequent pregnancies. Due to hyperflexibility in my hips and lack of cartilage in my knees, I was especially vulnerable to a repeat of all the joint pain I experienced in my first pregnancy.
What is your clinical opinion about how often diastasis recti and symphysis pubis dysfunction will reoccur in a subsequent pregnancy?
I would say the recurrence rate is very high in my experience. I treat a lot of pregnant women here. It's a neighborhood with a lot of young families. And typically second pregnancies are more painful Almost invariably, second pregnancies are more painful than the first because the tissue integrity and the tissue tension is always looser in the second pregnancy. Having been stretched and loosened through the first part of the pregnancy, the second pregnancy is almost always more painful.
I decided to embrace the movement parameters recommended by my Access Syllabus instructors to see if this would prevent or minimize reoccurrence. I continued to study with instructors who teach using the Access Syllabus and refrained from all other fitness and dance classes. I continued with contact dance improvisation, but strictly applied safe and efficient movement principles when I did so. I expected this approach to have some effect, but the result was beyond all my expectations. I experienced virtually no joint pain in my second pregnancy. My abdominal muscles did not separate, and neither did my pubic bone. And I only experienced minimal joint pain in my knees.
So for her second pregnancy, we didn't see the same degree of abdominal separation at all compared to what I saw in the aftermath of the first.
And how about symphysis pubis dysfunction?
Absent, also to my surprise. It was quite significant after the first pregnancy with a lot of audible clicking and movement, and I would have expected that to worsen through the second, which I had warned her about, but she had let me know that she was utilizing methods to try and counteract that, so I was amazed and very happy to see that it didn't happen.
Here I am 8 months into my second pregnancy studying the Access Syllabus in a class led by Ruth Duthright. How did the application of efficient movement principles make a difference? I feel that the traditional fitness, physiotherapeutic approach I followed in my first pregnancy caused me to continually squish and hit my pregnant belly. In contrast, I feel that incorporating the suggested protocols for spine, hip, and shoulder that are listed in the Access Syllabus into my dancing and daily life helped me make room for my pregnant belly. Dancing in spirals around the growing baby contained my pregnant belly in a movement hug.
The stance that the physio had me stand in, she wanted this to be my neutral. And if you can see, when I'm like this, my knees slightly point in. For the pregnant belly with the knees pointing in, it actually feels like there's not a lot of space. I can already feel a tightness here when I stand this way. You can actually see when I lift my leg in parallel that my thigh hits my belly. So if I'm going to climb stairs, it's like continually hitting the belly. The Access Syllabus neutral, as best I can understand it, is if I dangle my leg, there's a natural slight turnout in the hip. So instead of letting the foot fall in and the arch collapse, which tends to happen when I stand in parallel, I'm going to stand more on the outside of my foot and my knees track over my last 2 toes. The walking approach actually gathers in, and then I'm going to land aiming little toe and the second toe. And there's also can be a little sway too of the body. When I walk in that way, with being pregnant, I actually feel like I'm creating room for my belly if I'm going to increase the range. So if you can see, it's like the inside of my thigh bone moves up this way, and then as I go this way, the underneath of the leg hugs the belly. In my Aquafit pregnancy class and the pregnancy yoga, they talked a lot about the fact that because the pregnancy loosens the abdominal muscles, that women can develop a sway here. And to counteract that sway, they had us do a lot of tucking under so that we would not go into that overly swayed posture. In my first pregnancy, coming up from the bathtub or from sitting, I would tuck so I wouldn't develop that curve. But if you can see that tuck, it's like it squishes my belly. It feels like there's hardly any room. The Access approach is there's a feeling of the tailbone and the head moving apart. And if you can see when I do that, I don't develop an extreme sway. It's like the spine stretches and there's tons of room for my belly. So with this approach, I can only go this far, especially if I'm tucking under. But with the Access Syllabus approach, there is so much space for my belly that I literally can go all the way down to the ground. Coming back up, feels like I just float back up. Versus from here, whoa, I it's so heavy, I can already feel my back getting sore. In Access Syllabus, we work a lot with the sagittal. Sagittal is like, say there's a big wheel and I'm going to bend this way. And the vertical axis is this twist. I have found the sagittal and vertical a really lovely way to get the sense of twisting, spiraling around the baby. In my first pregnancy, when I did pregnancy yoga, I was going to like the end of my ability to stretch and holding it. So my feeling with the pregnancy yoga is that I was naturally flexible, extra flexible from being a ballet dancer, and then extra flexible from the hormone relaxant. I was working with this huge amount of flexibility, which I don't think was good for my body. Access Syllabus, they encourage you not to go to the nth end of your ability to stretch, but to work within a moderate range. So everything I did wasn't at the end of my ability to stretch. I worked a lot with Ruth in the later stages of my pregnancy, and she talked a lot about the propulsive system. So the propulsive system starts with the foot, and it runs along the inside of the body, and it's what I use to gather things together. There's a lot of Access Syllabus exercises where we have the feet together. And she really encouraged me to find, like, I have that much range, but she said I should use my propulsive system and gather everything in, and I should do all the exercises with less range of motion.
Here I am doing a version of the C-Star, a study in transitional alignment for entry and exit to the floor, that was first documented and decodified by Frey Faust, the originator of the Access Syllabus. The exercise allows for several aspects of locomotion to be evaluated: distance between supports, safe management of flexion and extension, and reception and propulsion phases. As I progress through the exercise, I am continually assessing how my pelvic girdle feels. When I feel the slightest tug or pain, I engage my propulsory system. During my second pregnancy, this was a continual process of listening to my body and reducing the range of motion in my hips as my belly grew bigger. I feel this strategy prevented shear forces from pulling apart my symphysis pubis joint. I believe that incorporating my Access Syllabus instructor's advice into my dancing and daily life improved my fascial fitness. I think this helped my pelvic girdle and legs to better withstand and support my pregnancy. Fascia is the connective tissue that holds our body together. Without it, our tendons, muscles, bones, and organs would be a pile on the floor. Healthy fascia has elastic properties, and if compressed and moderately stretched, it will bounce back to its original shape. You will need to engage in moderate stretches if you want to maximize the elasticity of your fascia. Stretching into and past your end range will take your fascia beyond its ability to bounce back. Fascia needs to be moderately stretched and compressed in order to stay healthy. It is like a sponge that needs to be squished in order to be hydrated with new water. Lack of bouncy movement can cause fascia to become dehydrated, tight, and bound together. Such fascia will reach its elastic limit sooner and is more likely to become injured. The fitness regime I followed in my first pregnancy, while it helped to strengthen my muscles, did not incorporate enough rebound and recoil actions to maintain and train healthy fascia. Through my study of the Access Syllabus, I learned about the properties of fascia and subsequently integrated these types of actions into my dancing and daily life. I also learned to generate movement by compressing and moderately stretching my fascia and then surfing on the rebound and recoil that would occur. During my second pregnancy, this strategy helped me to mobilize my core with ease despite its continually increasing weight and girth. Fascia health might influence diastasis recti and symphysis pubis dysfunction in the following manner. The linea alba that holds the rectus abdominal muscles together is comprised of fascia. Dehydrated, tight, and bound together fascia in this area may be less elastic and may tear more easily as the baby increases in size, resulting in diastasis recti. Due to weakness in the abdominal area, the weight of the baby, amniotic fluid, and placenta may be less contained. This may destabilize the pelvis, leading to pelvic girdle pain and possible separation of the symphysis pubis joint. In contrast, if the linea alba is comprised of hydrated, well-organized fascia, its elastic properties might easily allow for both growth and containment of the baby. Healthy fascia surrounding the tendons, muscles, bones, and organs that are part of the pelvic girdle might also work to stabilize the pelvis during pregnancy. The result may be a maintenance of the integrity of the abdominal muscles and pubis symphysis joint and a reduction in general pelvic girdle pain. If a fascial training fitness protocol would be of benefit for pregnancy, then timing must be taken into consideration. Robert Schleip and Devo Gita Muller, in their article Training Principles for Fascial Connective Tissue, describe how one needs to engage in a fascial training protocol regularly for a minimum of 6 months before a renewal in the elasticity of fascia can begin to be seen, and that the full benefit of such training protocols is often not seen until a year or two into training. One would need to start a fascia training protocol at conception or preconception for it to have an effect in later pregnancy. I will now show footage filmed during each of my 2 pregnancies to show some of the principles I have discussed and a contrast between the 2 pregnancies. Here I am dancing with my husband near the end of my first pregnancy. I remember experiencing significant hip, knee, and pelvic girdle pain during and after the filming. Let's see what might have been contributing to this pain. Here, my knee is pointed towards the inside of my foot. This placed shear forces on my knee joint and collapsed the shock-absorbing properties of the arch of my foot. I am stuck on the floor here. I remember, due to weak abdominals and pelvic girdle pain, once down, I could hardly move without assistance. I was like a turtle who had been turned over onto its shell. Once again, I am stuck on the floor, laughing at my predicament. It was a strange feeling for a dancer to feel so immobilized. As my husband pulls me up, I tuck my hips under and pull my chin down, squishing my pregnant belly and making my core feel very heavy. I know now a simple back extension would have made getting up so much easier. Here I am, planning my next move, with a slight shake of my head in disbelief as to how hard it is to move. Notice how my legs are in parallel alignment. This squished my pregnant belly, creating a tight feeling in my hips. Once again I have a laugh at my predicament, and then I reach for my husband's help. As he pulls me up, I tuck my hips under. This causes me to flatten out my lumbar curve. This is problematic because the lumbar curve is like a spring that helps absorb shock placed upon the body, and once flattened, the spring no longer works. As I get up, I once again adhere to parallel alignment of my legs. You can't see my feet, but my guess is this caused my foot arches to collapse, and combined with tucking my hips under created a labored feeling as I rose from the floor. Here I tumble down to the floor due to my weak abdominal muscles. Here I am twisting into my end range of flexibility. This probably placed shear forces on my pelvis, compromising its integrity. This is another example of stretching into my end range. I am not using my propulsory system to reduce the range of motion in my hips, as I did in my second pregnancy. Once again I am being pulled around the floor because I can hardly move. Watching this footage, I can see that my movement lacks the rebound and recoil that would have helped to improve the health of my fascia. It would have also helped to generate and recycle kinetic energy, which would have assisted in mobilizing my body. Here I am near the end of my second pregnancy in a self-study based on choreography learned in Ruth Doothwright's class.
Here to protect the spine, to protect the lower back, and then go, okay, because I don't want to have pain here. I've seen all of you in a beautiful deep flexion here. This extension, even with a massive belly, stretched with baby, the central abdominal muscles, they're supportive. Like I was here on the knees, right? And you're pregnant, but all this extra weight.
Like, that's just extraordinary to me, that I can still do that. It's a puzzle system.
Yeah. And it's very clear, like in your body, how you're doing your recycling.
Yeah. But I feel like animals, like,
Yeah, totally. You totally look like it. Yeah, yeah. It's amazing, that energy.
The recovery from the second pregnancy went at an astoundingly quick rate. So Kathleen was within a week or two after birth moving around in ways that it took months to years after the first pregnancy to do.
Here I am 3 weeks after the birth of my second child, studying the Axis Syllabus at Nomadic College at Earth Dance. This is an early morning self-study based on choreography I learned in Daniel Bear Davis's class.